Have you heard someone say you can reverse PCOS or maybe even cure it? So let's talk about why that messaging can be misleading and I think even dangerous. So I'm Dr. Mélanie DesChâtelets. I am a BC, Canada licensed naturopathic doctor, and I've worked with thousands of people in the PCOS space since 2010. I also teach other clinicians on how to support it. And I am the founder of the PCOS Shift Society membership for people with PCOS worldwide, and also the founder of the PCOS Health Collective, a clinic in BC, Canada. So, in this video, I want to help you finally understand why PCOS diagnosis is enduring. This is the word that they use in the clinical guidelines. So all of the brightest minds in the PCOS space have the same consensus that if you have been properly diagnosed with PCOS, this is a diagnosis that endures. And what does that mean? It's a diagnosis you have for life. And so I want you to kind of understand what that means and why cure language and reverse language, I think, can be misleading and also dangerous. So, for one, the PCOS diagnosis isn't as simple as other diagnoses. There are other diagnoses where we look at one lab work, we see it flagged, and you get the diagnosis, like easy peasy. But with PCOS, you have a set of inclusion criteria, for which even that changes based on your age of diagnosis. And you also need to meet a set of exclusion criteria. Now, I have 3 separate videos that talk about that, so go check them out on my channel. That's not the purpose of today, but I do want you to know about it because this will help you feel really confident that you have completed the diagnostic process and understand that when there are diagnoses that are a bit more complex to do, there's a little bit more room for error. So, what about curing PCOS or reversing PCOS? I have to admit, even myself early on in my career got this wrong. So, how did I get it wrong? I thought that if you no longer met the diagnostic criteria, AKA your symptoms changed, and you no longer met the diagnostic criteria that gave you the diagnosis in the first place, it meant you no longer had it. Kind of like you have high cholesterol, you do blood work, you go on lifestyle changes, and all of a sudden now your cholesterol is normal and continues to be normal for the rest of your life, and you no longer get that diagnosis. But that is not how PCOS works. So here is the good news about PCOS is that lifestyle can be have a pretty potent impact on how the symptoms present. And also the other things that you're doing, perhaps some supplements or some medication. And so someone may be very symptomatic at diagnosis and then do a lot of hard work and change. And then all of a sudden, the symptoms they used to have, they no longer have. But that doesn't mean we get to undo the diagnosis. And there's a few reasons for that. The underlying etiology or like what kind of drives PCOS is multifactorial. It's a lot of things, but genetics is one of them, and we can't just turn that off. And even if you're feeling better, people with PCOS have some higher risks that need to be monitored than their non-PCOS counterparts. So even if a lot of those symptoms and your quality of life has improved, it still needs to be on the radar. So the PCOS is enduring because of factors. And so, as I was just explaining, right, when we're comparing people with PCOS to non-people that don't have PCOS, we see this increased risk for people with PCOS. And this is true even when we match the 2 groups for body size, meaning we've taken out the element of body size. And so 2 people, same size, the only difference is the PCOS diagnosis. and they are at higher risk. Now, I don't want to scare you because this is not about being fear mongering. It's about empowerment and just knowing just because you're at higher risk of something absolutely doesn't mean that you are at higher risk of something. But if we pretend like you don't have PCOS anymore and we stop checking, then we miss the opportunity to catch things early, to catch things easily, to take easy actions. And that is the real risk, the real harm. Another factor that I think can be really harmful is that the language cure can cause harm. It gives people the illusion that if they take certain actions, everyone will have their symptoms managed. And there are a lot of people that take on lifestyle changes and take a lot of positive action, and it may make a difference. It may improve the symptoms to a certain point, and then they still have leftover symptoms that need to be managed in other ways. And that doesn't mean that they failed. Okay. It's just a highlight of the complexity and that there is a genetic underpinning there. And so we need to shift the messaging away from this perfectionism and attempt to cure to more personalization. So here's my analogy. If you've been diagnosed with PCOS, and we are assuming it was diagnosed based on the PCOS guidelines, and it was accurately diagnosed, then it is for life. This isn't a light switch we are going to turn off, but it is a dimmer switch. And so, yes, there are things that you can do that will make the symptoms of PCOS less bright than they were before. And for some people, that will be to the extent of normalizing cycles, having less acne, having less androgenic symptoms and hair loss on the head and hair growth on the face. And here's the last thing. We do not monitor PCOS with more and more ultrasounds. So it doesn't mean that someone with PCOS will never get another ultrasound in their life. It just means that the reason they're getting that ultrasound needs to be for another reason other than just monitoring PCOS. So how do you know that you are going in the right direction with your PCOS? Your symptoms tell you more than what the ultrasound will, and we would expect the morphology of your ovaries to improve if your cycles are improving because the communication between your brain and your ovaries would be in a healthier state. So, what do I want you to focus on? I want you to focus on sustainable systems over willpower. I don't want you to look at it as a pure horizon to conquer, a mountain to climb, and then that's it. This is something that you will be doing for life. It doesn't mean that there aren't things that you can do that can help you feel better than you are today. But I also want to be accurate in the wording because the risk of not being accurate is the risk of you not getting the care that you need, not being monitored early, not having risk factors identified quickly. And that's not a risk that that I want you to have. Anyhow, if you like this kind of conversation and you don't want extremes, you want clarity, community, and accountability, that's exactly what we focus on inside the PCOS Shift Society. So the PCOS Shift Society is my membership. I welcome you to join. Would love to see you on the inside. It's where we take information and turn it into action in a community of absolutely lovely people. All right. Have a great day.